on the names you let me know. Tenet Hospital, Dr. Hersch, okay, orthopedic surgery and sports medicine, which means that you're into sports.
Yes.
Something about the Miami Hurricanes? You do medical stuff for them?
No, I take care of some teams up here in Palm Beach County.
Wanted to ask you, do they have things in place now for concussions? I know you do the orthopedics and stuff like that, but I wanted to touch a little bit on the concussions, because has that changed? I know it was a big deal last year.
Yeah, I mean, as orthopedic surgeons, some of us choose to, and I do, to do team physician work. So concussions comes up all the time for me.
Okay.
And what's changed is that we do testing now. A lot of the high school kids, and definitely the professional, get testing beforehand. So they get a baseline test before the school year or seasons of where they're at. So if there is a concussion, now we have better ways of measuring when they're back to their sort of normal state.
I saw that pitchers now, they want them to wear helmets.
Helmets, yeah.
And I was a pitcher in high school and college, and I can't pitch with a helmet. What is that? That's like riding a motorcycle on the field.
The first and third base coach for years now are wearing helmets.
Right, but that's okay, because they're just standing there.
Yeah.
I do that too.
It's a design issue. I think they're trying to design comfortable helmets for pitchers, yeah.
Is it going to make a difference? I mean, you get hit in the face, I don't see that helmet protecting you too much.
Right, it'll only protect your skull, and there's going to be a lot of pushback, I'm sure, from the pitchers.
Excellent. Okay. Dr. Hersch, why don't you tell us what you do and where you do it, so we can plug that in, and then you can give us websites and phone numbers and good stuff like that.
Sure. I'm an orthopedic surgeon. I did a specialty fellowship in sports medicine, arthroscopy. So my practice consists of orthopedic surgery, fracture care, arthroscopic surgery, do a lot of shoulder, elbow, and knee surgery. I do a lot of sports medicine, a lot of sports coverage. I take care of a lot of tennis players, professional and amateur otherwise, and I'm a team physician for St. Andrew's School here in Boca Raton, so very involved in the athletics going on around us.
And you deal with kids of all ages, like seniors and children and everything else?
My office is filled with anywhere from adolescents till 99. I have athletes who play tennis at 95 years old and athletes who play sports at 12, so it's kind of all the whole range.
Gotcha. And where's your office located?
Southwest 18th and Powerline.
Okay.
In the shopping center there. It's actually now called the Boardwalk on 18th.
Yeah. And you're involved with West Boca Medical?
Yes. Most of my surgeries and procedures are done at West Boca Medical Center.
And how long have you been practicing medicine?
I've been in practice over 10 years. I've been down, actually more, 14 years. I've been down in Florida, about 10 years now.
Now, you went to my alma mater, NYU. But you went to medical?
Medical school, yeah.
Yeah, I was.
Go Violets. Man.
Yeah, go Violets. Yeah. I joined there to play basketball. Shows you how smart I was. Tell me, why did you get into this particular field?
Well, through medical school, I decided I liked surgery pretty early on, and arthroscopic and orthopedic surgery kind of challenged me. It's a very technical surgery, and the patients are, for the most part, healthy, trying to get back to whatever lifestyle, whatever thing they want to do, whether it's sports, work. So it's pretty rewarding in that respect.
That's cool. And you've decided to take this under your wing professionally. What one aspect can I ask you? I love asking this to doctors when they come on. If you could change anything in your field, and you could say, you know something, this is really what I would like to see change to advance what you do, what would it be?
The change in medicine in general?
Yeah. In your particular field.
Well, globally, I'd like to see sort of the access to medical care in this country be a little easier. It's more of a political discussion, I guess. But for instance, I saw a kid today who tore his ACL, pretty major injury, 4 or 5 years ago, and because of lack of insurance, he didn't go to the doctor for 5 years. So he basically didn't play sports for 5 years because he couldn't get to the doctor. So
wow.
He basically gave up most of his childhood, a part of his childhood, of enjoying himself for fear of his knee buckling on him, and finally he has insurance and will get him better.
It's taking what, 5 years?
Now he's 18. Wow. So things like that, it's kind of frustrating on both ends to people who have, young healthy people who have things that are correctable that don't have access necessarily to the right care. And so that's sometimes pretty frustrating.
Well, it's good to see that doctors do really care about what happens to patients before, after, and during. Why don't you give us a phone number and a website, maybe an address where people could come out and see you?
Sure, my website, you can make an appointment on there and see us. It's actually HerschMD.com. Hersch is spelled H-E-R-S-C-H. The office number is 561-417-3339.
Excellent. Very good. I want to thank you for coming on and thank Tenet for sending you down here. And we're going to invite you back when we have more time.